Thank you, Madam Chair. Reading the paper last night, lead editorial in the Washington Post, and I about dropped it when I read the first paragraph. And the title of the editorial is Living with COVID. Quite understandably, the coronavirus pandemic at first was a dire emergency, but it can't be one forever. The crisis will have to shift to a manageable health threat without massive disruption and overwhelming anxiety. President Biden has been fighting the virus as an emergency in his first year, but a shift must come before too long. Never thought I'd read anything like that in a place like Washington Post, but I think it reflects where we're at in the journey. And generally when you wrestle with something of this magnitude, where it's dominated the conversation for now 2 years, and you're still seeing results similar to, if not worse, from when we started, it would beg the question, do we need to take a different approach? It's been very top-down, been put in place, I think, understandably by the agencies that would be most pertinent. But when you look at the results, you look at the fact that a third of the country, for whatever reason, is not going to get vaccinated. You got a mandate that now is going to force the hand. And when you get someplace like the Washington Post saying that we got to take a different approach, I'm wondering, do we have it within our Constitution here when we've been bought in for so long that this is the way it's got to be? Listen to Senator Casey earlier, made a very good point. Everybody talks about data, paying attention to the data. And when this is so ravaged, such a small percentage, so significantly of our population with comorbidities that are elderly, it just keeps saying, why don't we change the approach? You don't want to have the legacy of being a country in disruption and full of anxiety. And kind of what I'm hearing here today, I'm not sensing that we're going to see a real change in approach, and even more so, doubling down on what now for 2 years has arguably not gotten us in a place where we feel better about it, where we're not drowning in anxiety. And I'm going to pose the question to Dr. Woodcock. You've been involved in federal health care in one way or another for a long time, acting commissioner at the FDA. Normally, a board of directors, a CEO, would be fired as a CEO, number one. A board of directors would be questioned in terms of how good they are, meaning maybe us here in the Senate, to where you're not directing for something other than what we've had, which in my opinion would be decentralizing it, providing the information to the American public to make their own best decisions. Dr. Woodcock, do you think that is sensible? Do you think the Washington Post makes sense? And are you willing to change up there on this panel to reflect accordingly?
Well, I think that we're talking about a natural disaster, and you can fire your board of directors because your factory was devastated by a hurricane, a tornado, or a wildfire, but I don't know whether that would improve the situation. I think right now we need to focus on continuity of operations for hospitals and other essential services as this variant sweeps through the population. I don't think that will last a really long time. But that's where I think we are right now. So I don't think prior approaches reflect what's going on right now. I think it's hard to process what's actually happening right now, which is most people are going to get COVID. All right, and what we need to do is make sure the hospitals can still function, transportation, other essential services are not disrupted while this happens. I think after that will be a good time to reassess how we're approaching this pandemic.
I'm out of time, but I think if you want to regain the trust of the American public, you probably need to look at a total revamp on what we do in terms of how we contend with it over the next year or so, or I think you're going to get more forceful editorials from places that you would never imagine. If you keep doing the same thing, generating the same results, that isn't the formula for success in any endeavor.
Thank you. Senator Baldwin.